And good afternoon, everyone. TJ Ald's I-45 now, 288 now, and Galveston now, and Clear Lake now. I got to get them all in now, Dr. Keiser. Welcome to another edition of What You Need to Know with Dr. Philip Keiser. He is the CEO of the Galveston County Health District, the Coastal Health and Wellness, as well as the local health authority for Galveston County. Dr. Keiser, this is actually as you and I are coming on the air right now live. We're close to 3 o'clock. We're only a few minutes away from hearing possibly, or at least the start of the announcement coming from the FDA is regarding to COVID-19 vaccinations being authorized for children 5 to 12 years old. That it's already cleared the hurdle from the CDC. Now it's ready for that FDA approval here. At this point, is there any surprises expected to come from this, or do you pretty much think, hey, based on what you've read and what has already gone before the CDC, which has already given authorization, that the FDA will go ahead and sign off on that today?
Yeah, we think CDC is going to sign off on the FDA's recommendation this afternoon. And, we already have vaccine in our hands. We have the pediatric vaccine. It's a different dose. It's a smaller dose. It comes in different vials. We've got doses here. UTMB has received their doses. And we're just waiting for the final announcement. And once that announcement comes forward, we can expect to start vaccinating almost immediately. Right now, we're planning on vaccinating probably start Thursday morning. So that gives us time after the announcements there to make sure all our systems are working and to get people in and getting vaccinated. But there may be some places that are even available tomorrow. But so we're very optimistic about it. We're really looking forward to it. We know there's been a lot of anxiety among parents and that they've been looking forward to this. So it's a very happy day around here.
And let's talk a little bit about that kind of logistics of things. Even if, say, at 3:15 our time, when the FDA panel sits down, even if they decide, okay, we've already seen enough, we're going to go ahead and vote right now, which is unlikely to be what happened. Doctors being doctors, they're going to want to talk to each other for a while about things. But how soon could we, in Galveston County, see shots available to go directly into arms of children 5 to 12?
Realistically, probably Thursday morning. The reason being is that we, have been planning on this, but there are a lot of things we didn't know until literally yesterday. We literally did not get the vaccine in our hands until yesterday, so we didn't even know that we would have it when the FDA has said okay, because they've said okay in the past, and it's taken like a week or so to get it. But it's been pre-positioned, it's in place. There are some updates we need to make in our software systems to accommodate the fact that we're dealing with younger children, different information, different dosing information. We got to make sure all those systems are working. We have to do some training with our staff that's getting ready to do it. Again, they're very experienced staff, but it's going to be, okay, everybody, last time we did it this way, this time we're doing it that way. And so just to be safe, we're saying Thursday morning, but we'll see how things go. But we expect vaccines to be available, very, very quickly. And I think, UTMB, I've been in on the plans with them as well. There will be a statement that will be put out between both organizations, as well as each organization will put out details about how parents can access the vaccine for their child.
At this point, because we're not probably, as I understand from talking with you about this over time, that we won't be seeing the mass drive-up type setup for this, correct? This will be individual going into a clinical setting.
That's right. That's right. So, so one of the big issues you deal with is that these are little kids, all right? These are, as young as 5 years old. They have a lot of anxiety. Not that, we didn't have anxiety when we got our vaccines, but, they need some more TLC. And we think the pace is going to be slower. Parents have expressed preferences to have them done in more private areas. And we think that if there's enough vaccine available, that if we spread it out to these various spots, we potentially could get through this in about 3 or 4 weeks. in terms of the numbers of kids who need to get vaccinated.
Is there a rough understanding of how many eligible children there are for this vaccine in Galveston County? Is there a rough number?
Yeah, so basically, we think it's about 25,000 kids between the ages of 5 and under 12. And of those, our best guess is that about half those parents will want their kids vaccinated. So we're looking at about 11 to 12,000 children needing to get vaccinated.
In fact, the county health district has been doing the survey, and we're seeing kind of the rough results here. 1,000 parents surveyed, and talk about the results that y'all got from that survey, because you asked all sorts of questions. Will you want to get your child vaccinated? What type of setting you want? Right. Talk about what the response was to that survey.
Yeah, so we sent a survey out. We posted it on our website so anybody could take it, but we also worked with the school districts who sent it out to parents. And the first question was, do you have a child at this age? And most people who answered said yes. And then the second question is, do you intend on getting your child vaccinated? And the answers were pretty definitely, maybe, I'm not sure, and then a hard no. Then if you plan on getting your child vaccinated, where do you plan on getting your child vaccinated? And the answers were, I'd like to get it in my pediatrician's office. I'd like to see a mass drive-in. I want to get an urgent care center in the schools. And of the parents that want their children vaccinated, most prefer to get it done in some sort of private office setting. And so that's what we've been planning on writ large. But we also recognize that probably early on in the first week or two, there's going to be a big demand for this. And so we want to make it available everywhere that we can. So we're going to have clinic here at the health department where parents can bring their kids through. UTMB is going to be having clinics. We don't know. We know that some other private pediatricians will be having clinics. We would simply urge people to look at our announcements, look at other people's announcements, call your doctor and see if they have vaccine available. And hopefully it'll be something that'll be very simple. You go in, take about 10 minutes, get the child vaccinated, wait the requisite 15 minutes, and then be on your way. We've got lots of stickers and lollipops and sweets, and we're not having clowns because while some kids love clowns, some kids, it scares the hell out of them. I probably should have said that. But it can be frightening thing. We want to make it a welcoming, non-rushed, easy environment so that the younger children who are having concerns about getting vaccinated don't worry about it.
What is the real difference between outside of the orange cap versus I think it's blue cap for the Pfizer biotech COVID-19? What's the difference between the two?
Yeah, well, there's two. One is that there's a difference in the actual concentration of the vaccine. So the child's vaccine is ready to go, meaning that you don't have to thaw it out and dilute it. That's very important because, in the past, what we do is we take it into these -80 freezers, which are very cold, transported to our vaccine site, and in these special freezers that kept it cold, and then would take out each vial at a time. Okay, we're going to thaw this one, we're going to thaw this one, we're going to thaw this one, and then dilute it up and then give them out. Okay, but with this, it's a separate system that doesn't require that ultra cold freezing. So that means that it can be out in normal freezers. And then the second thing is that it's a smaller dose. It's 1/3 the dose that an adult would get, which means that the child is actually getting exposed to less of the antigen. They have very good immune systems. Their immune systems will respond, but it also means that they're not going to be as likely to have side effects as some of the adults. And that's part of the reason why this vaccine took so long to develop, because COVID has less of effect in children. And so with the safety aspect of this was very, very important. And they've looked at this very, very hard. And I think, this is about as good as it gets.
And there's still, though, the separation between first shot and second shot.
Yeah.
There, it's 3 weeks. But you said, too, that the timing is a little bit different with this. You can't go too early.
Right. Can't go too early. Right. So now we have about 4 days grace early. so they can come in, so they get their first shot, and then 3 weeks later, they're supposed to get their second shot. Well, we all know that that's hard to do. And particularly what we're looking at, if we start vaccinating this week, then 3 weeks takes us into the holidays, right? So if you get your vaccine on Thursday, 3 weeks later is Thanksgiving. Okay, well, we're not going to be giving vaccines out on Thanksgiving, but we will be the day before, and we will be that week early. So, we're going to have to work on those scheduling to make sure that people can either get it earlier, if they don't want to do it then, that they can come back a little later and get it. But it's still that 3 week window that we're looking at with those periods of time around it.
For those of you just joining us, it's our weekly visit with Dr. Philip Keiser, the local health authority for Galveston County, also the CEO, Coastal Health and Wellness, and the Galveston County Health District. And we're talking about the approval of Keiser vaccine for COVID-19, expected for children to be approved today, for children 5 to 12, we should say, today, 5 to 11, I should say, today. When that's done as early as Thursday, we may be able to see a local effort going along. Deanne Hunt had asked this question. It says, is there a place for people to sign up now? You had said earlier in the show, not just yet, because you're having to get the software caught up to be able to take in the registration.
So we have to, right. So we open up appointments. We just want to make sure that works well. We're giving kids a little longer time and for their appointments than we would for adults. Adults, it's easy. It's just I come in, sit here, boom, go, sit over there, and you're done. For children, we recognize that it may take a little longer time, and so it's going to be a little bit of a slower pace, and we just want to make sure that everything's working. We want to make sure that everybody's understands the differences, and so we can do this well.
And a question had come up based on your comment here, and I think we need to clarify something, is that Brian Alker says less effect in children than why get it. It's not less effect here. It's just developed differently because of the child's own immune system is a little bit stronger, right? I wonder if you can go over that detail again.
Sure, right. I think I misspoke when I said that. I know exactly what he's saying, because when it was coming out of my mouth, I'm going, oh, I'm not sure I mean that. Yeah. So what it means is that there are two things that happens when you get a vaccine, right? You get an immunologic response, but when your immunity wakes up, it can also your whole immune system reacts, and that's why, particularly when we all got the second shot, people felt feverish and achy, and their arm got sore. And one of the things we saw in older young men, that they had a few cases of myocarditis, inflammation around the heart. And I'm not trying to minimize that at all. And the good news is that even in those cases, there were no serious things that happened to those young men. We didn't see anybody die. We didn't see anybody need a heart transplant, and I know some people are thinking, what do you mean die or getting heart transplant? Well, as doctors, we see that things like this happen. And so when that doesn't happen, we think that's a good thing. And so when they developed the vaccine for the children, particularly in that age, the 5 to 11, children have a very robust immune response. So what that means is that the amount of immune response that they need to fight off the virus, or the amount of antigen they need, i.e. vaccine that they need to fight off the virus so that they have a good immune response, is less than what an adult would need. And that if you give them even more, then one of the things that people worry about, and it didn't happen, but one of the things you worry about is, is that more vaccine, is that going to translate into more side effects? So they got the dose down as low as possible so that they could get that good immune response, but not so that it goes over the top, and then the kids have more side effects than you would see in adults. And in fact, they actually have less side effects than you see in adults. So overall, it looks very safe. So the reason to get it, one, prevent your child from getting COVID, and also to prevent spread of COVID among your family and to other people.
And we should probably point to, this is a good time to talk about how vaccines work. And these vaccines actually work by getting your immune system kicked into high gear.
That's right.
It in itself is not the shield.
That's right.
So it's telling your body, here's what you need, body, to fight this virus.
That's right.
Right.
Yeah, that's absolutely right. And our immune system is what protects us from all of these different infections, and our immune system has what we call memory. So if you have never been infected with something before, the first time your body sees it, there's this huge response. Oh my God, what is this response? The second time it sees it, it goes, I've seen this before. And then it brings in all of the different cells and antibodies and things that it needs to fight off the infection. And that's why typically with, we don't get things like measles over and over again. We don't get, a lot of different infections over and over. You get it once, and then you tend not to get it again. And that's the basis of vaccines. They trick our body into thinking it had the infection so that it has the memory, so that when it sees that infection for the first time, it goes, aha, I recognize you, and it knows how to fight it off.
One of the things I want to ask coming up this weekend, and we'll get back onto the subject of the child immunizations, the 5 to 11-year-olds. We're hoping as we're talking here, we'll get word officially down the line on that. But another thing that's coming up this weekend is we've seen the downward trend happening here lately, leveling out. Lone Star Rally is this weekend, the big motorcycle in Galveston. If this had been a year ago, we'd be talking about a super spreader event. And being concerned about that. How concerned are you now about events like this anywhere, not necessarily just Galveston, but anywhere as being a super spreader event?
Well, we worry about that. And we worry about not just this event, but a whole series of events over the next several months. So we're looking at, we have the Lone Star Rally, and we're actually participating in the Lone Star Rally. We're going to have a booth there. We're going to offer vaccinations for COVID and flu. We're going to be doing blood pressure checks. We're going to be, checking people's sugars. We're going to be handing out water and just trying to be part of the community and promote good public health. But if we have an event like this, followed by a lot of travel around Thanksgiving, which is actually much more worrisome than even the Lone Star Rally, and then we have Christmas, and then we have New Year's. I mean, look back at what happened last year. We may see a similar type of rise in the numbers of cases. And so right now we're in a good spot. Our numbers are low. This is probably the best weekend we've had in 6 months in terms of having an event like this, because right now the numbers of positive cases we're having in our community is only about 2 to 3%. The good thing about the Lone Star Rally is much of it is outdoors, and we know that most of the transmission that does occurs in crowded indoor areas. And so as long as people are staying outdoors, then that's protection. And we have good breeze, that'll help a lot. But we would still recommend, that people wear masks if they're in tight areas, even if it's an outdoor concert, or if they're walking around in the in the areas where there's sales and other promotions going on.
Also, too, it gets into you don't know when you have these groups how many folks are vaccinated or not.
Right.
While the rate in Galveston County is at 70%, elsewhere it's not. This is an event that brings folks from a different region. And does that up the concern some as well?
Yeah, and a lot of it, I think I'll have a better sense of how concerned I will be depending on how people react to us at the rally, because I find that you think you can predict how people are going to react to you, but when we look at our numbers, the older you are, the more likely you are to have been vaccinated, regardless of what your race, your political affiliation. Over 65, we've got 85% of the people in the county vaccinated. And so if you look at the demographics for the Lone Star Rally, most of these tend to be, men who are a little older, who have the means to afford these motorcycles. And so I'm hopeful it will be okay. But yes, anytime you're bringing people in from a wide variety of areas and you put them together, you never know what's going to happen.
One of the things in seeing the downward trends, last week we commented how low the actual hospitalization rates had. Well, for the longest time, we were hovering over 100 people who are Galveston County residents in the hospital at any given time. That number has dropped into the 30s now. Right. And I'm wondering, as we look at things, are we finding too that the treatments are better and the therapies are better in there. It's keeping those hospital visits down at this point.
Yeah, well, I think it's a combination of two things. It's the number of cases, but also I think that we have gotten a lot better at the way we've treated people. There's been new data that's just been released that looks at death rates over time. And certainly death rate, or what's called case fatality rate, i.e. the number of cases versus the number of people who have died over time, that's gotten much, much better over the past year and a half. And certainly the antibody therapy that we used a lot of in these last 4 or 5 months has a huge effect in keeping people out of the hospital. The other nice thing is, as we've seen the numbers go down, our numbers of deaths have also dropped off. So we're in about as good a place as we've been since this has started.
You talked about the antibody infusion. There was some recommendations that came down from the federal side that almost limited the use of the antibody infusion compared to what was actually happening on the ground early on.
Yeah, that's right.
And so are you finding that, though, have those restrictions gotten in the way, you think, or you think it's still working out fine?
It's still working out fine. We were worried about that. We were worried that there would be a limited supply. At one point, they announced that they would only have certain amounts. But at least for us, what happened was the rates started dropping along with, around that time that they started limiting supply. And that's actually something that I've come to rely on, just looking at it as a metric of how we're doing, is how many antibody infusions have we've done. And we've done, just as we've seen the case numbers go down, we see the rates of people getting antibody infusions go down as well. So it all adds up to being good news.
And getting back now, we have let me bring this up from one of our viewers. Going back to if those of you didn't join us early on, we're expecting word sometime this afternoon from the FDA on giving approval about for the child version of the Pfizer COVID-19. That's 5 to 11. It will be, I think if it is approved, it'll be emergency authorization still, just like it starts off, and then eventually they'll see from the data to move from that. We explained some of this before, but Nancy Stevenson had asked, what is in the children's vaccine or not in it that is different? You had said earlier, it's the same thing. It's just different concentrations, right?
Yeah, it's different concentrations, and then the what they call the carrier, which is basically the solution that the vaccine is in, is a little different, and that's actually a good thing. What that means is that unlike the other Pfizer vaccines, where you have to keep it really cold, you don't have to keep it as cold. So those are the two main differences in the children's vaccine.
And then we're getting into the flu season here, not too around the corner. It's officially started, but really when we get in the heart of it is coming up. Holiday season coming up as well. As you look at, as we go down the next few months, get your crystal ball out. What are we looking at over the next couple of months between now and January?
Good question. Our number of flu cases is still quite low. And so, we start monitoring flu in October, and throughout the month of October, we've had precious few positive flu tests. There are other viral illnesses that are going around that people are having, and so people were worried, COVID numbers are down, and so people aren't going to get COVID tested. And that's not true, because these other viruses are around there, and they're going, oh, do I have COVID? And they get tested.
Right.
And we're finding out that they don't have COVID. We don't necessarily know what it is. It's not COVID. It's not flu yet. We are worried that in general, when you have a virus that dominates, it tends to drive the other viruses out. So if we're seeing our COVID numbers drop because a lot of people are vaccinated and people are being careful, we are worried that gives an opening for flu to come in, and we might see a bad flu year. So we have flu vaccine, and we are recommending that people go ahead and get vaccinated for flu if you haven't had it already.
Right. And then as we get around to it as well, at some point, what do you expect that there'll be kind of this annual kind of get your flu and your COVID vaccine kind of at the same time? I think that's going to become kind of the normal thing.
Yeah, might be, and we'll wait and see what that really looks like. But it wouldn't surprise me if it turns around and it's like, okay, it's time to get your COVID vaccine, it's time to get your flu vaccine, and then we also have these tests widely available so that you just walk into a doctor's office and you can get a test that'll see whether you have COVID or flu or any of the other viruses. And then, with Merck's pill coming out, there will be a treatment for COVID that you can take by mouth. And that's not going to be the first one. There's going to be more coming after that. So I think we're going to have a lot of options available as we move forward into 2022.
And Merck is going to be the thing. What are we hearing timeline when Merck may be available on the market?
Hard to say. I would say probably sometime, maybe this time next year, or maybe summer next year.
So it'll be a while yet before we get.
Yeah. I mean, they're going to push it through quickly, and I think one of the things that the FDA has learned is how to evaluate important drugs in a much more rapid fashion, so they can get to the public as they're needed. So it wouldn't surprise me if it comes earlier, but I don't think it's going to come really fast.
And also too, what are you hearing on right now? If you go in for a vaccine, the federal government's paying for it. It's still our tax dollars, so
right.
you're paying for it, but not directly. At what point do you we'll start seeing that kind of flip over where you got to pay a shot copay and your insurance is covering the rest?
Yeah, it's hard to say. And we've already seen that, that health systems are charging for like COVID tests, the administration fee, and for the antibody test. Now, people don't have the ability to pay those fees. They're supposed to provide them for them anyway, and for the most part they do. But it's really hard to say when that's going to change. We're already hearing that some insurance companies are talking about not covering COVID-related illness costs if you didn't get vaccinated.
Right.
Whether it's really going to come to fruition or not, who knows? But it does show you that there's going to be a limit to what we can pay for these sorts of things as we move forward.
And my apologies for those that saw the camera drop there. I'm actually working off a remote camera as we had issues with my computer here today. So, and the suction cup just came loose. So that's why you saw me fall to the ground real fast. I didn't fall to the ground. Camera did.
You did a backflip, TJ.
Yeah, I know, right? That's what it looked like there for a second. I'm wondering though too is it gets in. This is a public health issue. It's not one that would be in your wheelhouse a lot, but I'm sure you'll see something on that. But your opinion on insurance companies deciding, okay, if you don't get vaccinated, we're not going to cover you if you get sick with COVID.
I think they're going to have a hard time with that one.
Yeah. Like, okay, if you come in with any type of ailment, if you smoke, we can't cover you.
That's right.
Which would be the kind of the next logical step. And I understand it. And so I wonder if they're going to find that as a tougher kind of road to hoe.
I think they're going to find that hard to do. What we've really seen happen, like say with smoking or people that are overweight, it isn't so much that you get penalized but you get incentivized. So, okay, if you smoke, but if you stop smoking, we'll cut X dollars off your insurance.
Right.
We'll do this, or we'll give you coupons for this sort of thing, or Medicare actually has something they call the not silver slippers, maybe it is silver slippers, but they have a thing for anybody that's enrolled in Medicare. They'll pay for gym membership for you,
right?
So that you have an opportunity to go get exercise. My father
silver sneaker,
yeah,
right. Silver sneaker, right?
Silver sneakers. There you go. Right.
That's it.
And so it's I think probably more incentive campaigns is something that the public would be willing to swallow. I know as a doctor, anytime you get told that you have a patient in front of you who's really sick, and that, oh no, the insurance company won't pay for that, it makes you sick.
Yeah, it gets frustrating for sure.
Yeah.
This is more of a comment from here, but it does lead into a good question to ask, as always. As Tara Kerfoot puts in, BS is natural infection provides protection, and we've addressed this a lot.
Yeah,
that's accurate, but only to a point. And
To a point. Yeah,
yeah,
yeah, yeah. So we were talking earlier about this idea, and a paper just came out talking about super immunity, and
right.
and so people that have been infected and then get a vaccine, they actually have better immunity than people that were fully vaccinated who never got infected. So there's something about getting infected that really revs up your immune system. Now, the danger in saying, "Oh, I'm just going to wait till I get infected and that'll take care of it," is that that's okay if you don't die and you don't get up in the hospital, or you don't get long haul COVID and you don't end up with brain fog and you don't end up, all of these different things that can happen to you. But for people who have been vaccinated, the data is now showing that if you just get one shot, that you get really good immunity. And I've actually had people come to me and say, "What if I just get one shot?" And I go, "Yeah, let's do that. Let's see how it works." And so, it's really good to know that kind of guess is turning out to be is turning out to be right. So, if you've had an infection with COVID, just get one shot, and you're probably going to do very well.
In many ways, as you had said before, it acts like the second shot
Right.
at that
Exactly.
case
Yeah.
for there. But we never said that, and I think it's important to note we have never said that having the infection meant that you weren't protected at someone. It never was known how long
Right.
it would, and it looks as you were talking about that super immunity study, and I will put the link up for that. Just found it this morning. It's an interesting study. It's a peer-reviewed study, by the way,
Mm-hmm.
where it shows that those who were not vaccinated who got COVID had about 6 months afterwards
Mm-hmm.
of some type of immunity.
Mm-hmm.
Those who were vaccinated, who had gotten COVID and then got vaccinated, the immunity lasted a lot longer.
That's right.
For them. They're over a year in some cases for what they've been able to that they're estimating there. So what they called super immunity.
Yeah.
But that's better off than someone who had never had COVID and just got vaccinated.
That's right.
And that turns out to be well. So there is something to be said. Yes, getting sick and then getting vaccinated. That is a dice to roll, even if you don't end up in the hospital or dead. It's a pretty rough way to make sure you're immune later down the line. Well, having done it, by the way, as I said, having had COVID, it's not fun.
Yeah.
By any means.
We wouldn't recommend that people go that route.
Right.
But if you've had COVID, come on in and get your booster, right?
Yeah.
And you'll be better off for it. And not only that, you get the luxury of not having to suffer through the second shot. So that's a good thing as well.
Again, Dr. Philip Keiser, the CEO of the Galveston County Health District and Coastal Health and Wellness, as well as the local health authority for Galveston County, on with us for this weekly show. We're waiting for official words. Probably their meeting has already gotten underway. It was supposed to go 3:15 our time. We'll probably hear that recommendation sometime this afternoon. But recapping on that is that this is for children 5 to 11 for their vaccine shots. The county health district did a survey of about 1,000 parents who 50% said they want their child to get vaccinated. The other 50% said they either wanted to wait or they weren't interested at all. Totally understand that sentiment, actually. When it comes to kids, that becomes a concern there. And we'll see how that goes. But for that 50% that want to go ahead and get their children vaccinated, it could start as early as Thursday, because the vaccines are actually the child-based vaccines. The smaller dosage are actually already in hand, ready to go.
Yeah, so we're ready to go. We're waiting on the okay from the FDA, and we'll be ready to start as soon as they tell us that we can do it.
And the vaccinations will be available, at least what we know, there'll be some type of clinic set up through the health district, and then also working with UTMB, correct?
Right. That's right. So we expect them to be widely available around the county.
And it won't be we won't have a drive-through event or some mass vaccination.
No, I don't think so. The reason to do the drive-through is because the demand really exceeded the supply, and we had to have a wait list and all of that. We don't think that we're going to need that, and we don't think that the numbers of people who we calculate to get vaccinated really warrant doing it at this point. But if we have to, we'll do it. So we're very anxious to see how many parents want to get their kids vaccinated.
You said too that some school districts have reached out too about having some type of vaccination done on campus. How would those look?
Well, so it would really depend on the school district, but in general, what they have asked us to do is either do a Saturday or after hours thing. We'd probably set up in a school gym or in a, depending on how many kids there'd be in maybe in the nurses area. But just have a way that we can move people through. We're going to work with the schools to make sure that those that have requested them have enough demand that it warrants doing that. So if they say we'd like to do it and we only get 5 parents show up, that'll be, you can come over here and we'll do it for you. Maybe we'll just send our van out and do a few. But as long as it's enough to warrant doing it, we'll work with the schools and try and get as many kids vaccinated. The one things we want parents to know is that we do want the parent or guardian to show up. If you don't get your brother-in-law or your cousin or your next door neighbor to bring the kid in. We want someone who can legally say, I want this child vaccinated, this child belongs to me, to do that. But other than that, it'll work just like the way it has with all of the other vaccine efforts.
Two is we will see how these efforts go. We'll have more details of that as it comes out. Expect that as maybe early as tonight we'll announce it of what the plan will be.
Right. So what we're expecting, we're waiting for the FDA announcement, and then we will probably be putting out a press release and notices on social media about this is what we expect, and then this is how you can make an appointment, and we'll update that as we get more information and we're ready to roll. But I think realistically thinking, if they approve it by the end of the day, that we may be able to do a couple on Wednesday. Don't count on it, but probably Thursday.
And then from there, it'll be, as you said, a lot of folks had answered in the survey that they wanted to be able to do it in their own pediatrician's office.
That's right.
So that'll be an emphasis along the way there. I'm wondering, we know UTMB has the pediatric clinics all across.
That's
the health district, though, pretty much you guys set your appointment up at the one location in Texas City? Or
no, actually at all the pediatric clinics throughout the UTMB system is what the plan is. Again, I don't know as of right now whether that will be available at all clinics come Thursday, and it's it's going to take a little time to roll everything out. And there's a lot, because we roll it out to different locations. It's a lot of staff that needs to get trained on how to do this properly, and that takes a little bit of time.
Again, Dr. Philip Keiser, the CEO of the Galveston County Health District, and also the local health authority, has been on with us as we get ready for the announcement we expect today to come about the COVID vaccine for children 5 to 11 years old, really the last population who has not been covered by COVID-19 vaccination. And as I said, we expect that answer this afternoon, and we'll have updates for everyone here when we find out for that. Dr. Keiser, good to see you again. Thank you for coming on with us. We appreciate it. And again, folks, if you have any questions, we'll be back on again next week. We'll be taking Thanksgiving week off for sure, so we can hear about all the turkey Dr. Keiser cooked up. And we'll have that. This has been What You Need to Know with Dr. Philip Keiser.